Hi friends, happy April Fool's Day. I wish I could come on here live and tell you that this has all been one big, very tasteful joke, but unfortunately all of us know that that is not the case. So I am instead going to come and do video number 6 for you, hopefully provide you with some useful information on your day-to-day activities. Unfortunately, our numbers still continue to rise. I think we all know that. And we have not yet peaked as a country. Even states like New York that are really, really struggling right now have not yet hit their expected peak. Here in California, we are expecting it to be closer to 4 weeks from now, and as a country as a whole, somewhere around 2 weeks from now. Before I get started, I do want to give all of you a very sincere thank you, specifically those of you who are practicing social distancing. I know it's hard. I know most of you are going stir crazy. I know that the patience levels in most households right now are probably pretty nil. The kids are starting to go a little crazy. The schedules have gone out the window. And my advice is to just keep pushing. For those of you that are practicing social distancing, as dramatic as it sounds, you really are saving lives and you are leading by example. So I want to say thank you because so many of you have said thank you to me and to my colleagues in the healthcare community, and I just wanted to come back out and say thank you because I do see all of your efforts and that so many of you are staying at home like you need to be and you are doing your absolute best in terms of social distancing, and truly it is going to be the community at large that makes a difference in this pandemic as much as our healthcare workers do. So thank you, thank you, thank you. I know that another challenge that a lot of you are facing as you guys are starting to go a little stir crazy at home is that there's information overload out there, and a lot of the information feels like it's constantly changing. They said one thing 2 weeks ago, now they're saying this. What am I supposed to believe? And so today I just wanted to talk a little bit about day-to-day living and some questions that have been brought my way several times. And one of them in particular is whether or not this virus, COVID-19, is airborne. And there seems to be conflicting data about this. Some say no, absolutely not, and others say yes, it absolutely is. And so we really just don't know yet. We're still learning. The best guesstimate that we have right now is that it is able to remain in the air like an aerosol. Maybe 2 to 3 hours, but more than likely less than 1 hour and only under certain conditions. But we're still trying to figure out what those certain conditions are. Most experts will still tell you that this is not going to be the primary mode of transmission. The most common way that someone is going to contract this coronavirus is going to be through someone coughing or sneezing close to you, and then immediately you're right in their face and it goes into your mouth or into your nose or into your eyes and then enters into your respiratory tract. So first and foremost, we have to go back to washing our hands and not touching our faces. This, quite honestly, is going to be what is going to reduce your chances of contracting this virus more than anything else. I promise you that. And going along with whether or not this virus is airborne, people have asked, can I run or walk outside? Can I exercise outside? Can my kids play outside? And I think first and foremost, you do have to follow your local city and state guidelines. They are getting more and more strict, particularly in areas that are heavily affected. And so, for example, for me, if I lived in Queens, New York, I probably would not be going on long runs or long walks, spending hours outside because they are so heavily infected right now. But to be honest with you, with the research that I've done thus far on how airborne of a virus this is, meaning that it's lasting in the air for less than 1 hour, I personally am choosing to run and walk outside, and I do let my kids play outdoors because I think it's a balance. We need a little bit of that sunshine. We need a little bit of that vitamin D. We need that sanity. We need to get our wiggles out, if you will. And at this point in time, with where I live, I think that the benefit of doing those things outweighs the very small risk of a few particles being in the air for less than an hour if a person who happened to be infected was in that exact same spot that I chose to walk or run in within the last hour, if that makes sense for you. Going further upon this issue of airborne particles, the topic of masks has come up. And in one of my previous videos, I had mentioned that the CDC recommends that if you are not a healthcare worker and you are not sick, and you are not directly taking care of a patient with this virus, then you don't need a mask. But quite honestly, times are changing. Our numbers are rising very quickly, and we're starting to change our approach. And we are thinking that perhaps masks may be helpful when you leave your house, for example, to go grocery shopping, because perhaps it is those individuals that are asymptomatic that are shedding the virus that may be contributing to the rise. And if we can help people to not shed their virus, then obviously we can slow the spread. If you have a homemade mask that is in no way impinging on your local healthcare community's supplies of masks, I would say wear it. It's not a 100% guarantee that you won't get the virus, but it may be able to decrease your chances. And if you happen to have it, but you're asymptomatic, it's certainly going to decrease how much you spread it when you go out and do your essential activities. This does not mean to hoard or steal or even buy healthcare masks. It's not to say that your healthcare workers are in any way more important than other people. But if our doctors and nurses and respiratory therapists get sick, then the sick will only continue to get sicker because there's no one to take care of them. I have seen so many grassroots efforts about homemade masks where people are sewing the masks and then they are actually putting different types of filters on the inside. And I think this is truly incredible. And for those of you who are part of these types of movements and you're donating to the hospitals around you, again, thank you. If you're making one of these, make one for yourself and go ahead and wear it on the outside. I think that that's okay. Again, it's not a guarantee, but as times change and our numbers rise, if you have access to a homemade mask, then absolutely go ahead and use it. The next topic that I wanted to cover was, does the virus live on surfaces? And a recent New England Journal of Medicine study found that it behaves like other coronaviruses, and so it can be found on copper for up to 4 hours, cardboard for 24 hours, and plastic or steel for up to 72 hours or 3 days. But the amount of the virus decreases rapidly on those surfaces. So again, the risk of contracting the virus from these surfaces is going to decrease with time, and this is not the primary mode of transmission. You can't get it from simply touching the virus through your skin. It has to get onto your fingertips, and your fingertips have to go into your mouth, your nose, or your eyes. So again, that's why we've been saying wash your hands and don't touch your face. Even if I touch the virus right now and it's right here on my fingertip, if I go and I wash my hands with warm soapy water for more than 20 seconds, it's not going to be on my finger anymore, and I'm protecting myself. Along that note, people have asked me, do I need to wipe down packages that I'm receiving in the mail or the groceries? And so I ask them in return, well, here's what the situation that would have to happen. Someone with the virus did not wear a homemade mask. They went to your grocery store. They coughed in the bread aisle, and a viral particle landed on the loaf of bread that you chose to buy. You bring that loaf of bread home, and technically that virus can live on the plastic wrapping of the loaf of bread for 72 hours. But of course, the virus is gradually dying because it doesn't have a living host to support it. You then touch the virus with your finger as you are getting bread out of the package, and then you touch your bread to make your sandwich, And then that virus that was on your finger now gets onto your bread, and then the bread gets into your mouth, and the viral particle has to get into your respiratory tract, not your GI tract. And that's how you're going to get it. So is it possible? Yes. But is it likely? And certainly, is it as likely as are you going to get it if someone were to cough and sneeze in front of your face? No, it's not. So this is the information I present. If it makes you less anxious to wipe down your packages, to wipe down your groceries before you bring it, and you enjoy your food a little bit more, then I don't think it's going to hurt. Do I think it's absolutely necessary, or am I doing this in my own home at this point in time? I'm not. Others have asked, do I need to wear gloves when I go grocery shopping? And quite honestly, the answer is no. If you're washing your hands before you eat and you're not touching your face, that I don't really know what good the gloves are doing, because if the virus is on the plastic of your glove and you put your glove anywhere to your face, you're still going to get it. So just wash your hands. And lastly, I did want to touch a little bit more on social distancing guidelines. And again, as I have mentioned in my previous videos, I think that the best guideline is to act like you have it. Again, I know that we are really tired of this, and sometimes it feels like there is no end in sight. And I'll talk about that in a moment as well. You can't bend the rules right now. You really can't. And if you are asking, can I do this? Do you think it would be okay? Ask yourself, if I had the virus, would I even be asking this question? And I think that will oftentimes answer it for you. The 6 feet rule that a lot of people are talking about refers to when you absolutely have to go out. So when you have to get your groceries, try to stay 6 feet away from people. But a lot of people have interpreted this as, well, we can all sit out on our lawn, and as long as we're 6 feet apart, then we're probably going to be okay. But again, this is us starting to bend the rules because we are craving that social interaction. And see, there I go, I just touched my nose. And that's natural for us because we're humans, and that's what we do. We socially interact. But to me, we do have to start to become a little bit more strict, and hanging out on our lawn 6 feet apart is not necessarily going to guarantee that we don't spread this, because again, 6 feet is an estimate. Maybe that one viral particle traveled 7 feet instead. Or, when you're 6 feet apart, are you really 6 feet apart? At some point in time, I'm sure you move within a closer vicinity of one another. And if it's not absolutely necessary for you to do that, I personally don't think we should be doing it. The bottom line is that this virus spreads from person to person. I'm less worried about it spreading from air to person or surface to person. And so if we stay away from one another, this is how we slow the spread down. And so again, it just means staying home, staying with your families, staying away from other people. And last but not least, so many people have asked when I think this is going to end. And oh boy, did I wish I know that answer. I really don't know. As I mentioned, there are some good epidemiological trackers, if you will. They're mostly for hospital purposes, and they anticipate that, again, we have not yet hit our peak, that it is coming for the United States in about 2 weeks, mid-April, and for California towards the end of April. Some are hoping that as the weather gets warmer, it will go away. But Dr. Anthony Fauci, who is the head of the National Institute of Allergy and Infectious Disease, actually thinks that if that's the case, it may in fact come back next fall and winter. So we just don't know. But if you are like me, and when your flight is delayed in an airport and they tell you it's just going to be an hour, and then in an hour they tell you, oh, it's just 1 more hour, and then in another hour they continue that, and they do it for 4 to 6 hours until you are so angry that you just wish they would have given you the truth in the beginning. I honestly would say, you know what? Fix your eyes on June. That's my best guess, and hopefully I'm wrong and it will be sooner. But I think it's better to have maybe a realistic expectation and then be pleasantly surprised if this gets better sooner rather than later, as opposed to being strung along with dates like April 1st and then Easter and then April 30th. So we're in it together for the long haul, you guys. I cannot express how important it is to take care of yourself during this time, physically and mentally. As we sort of tire of being in this predicament, like I said, we're going to start to bend these rules because we are human and we crave that social interaction. But that's not going to help us. That's just going to infect us more. And so find what you need to find that will help to give you strength and peace and calm, because we are going to need it, but we are going to get through this together, friends. All right, that's it for today. Have a great day, you guys.